Kia ora, nau mai ki tēnei a tata o te manatū hauora. This infection prevention and control guidance is for residential care staff working in New Zealand. It shows the best approach to putting on, taking off and disposing of personal protective equipment in a residential care setting.
As an aged care worker, I provide healthcare for New Zealanders every day. I've been working here for 14 years now, and I love taking care of the residents and working with a great team. To do my job well, I need to protect myself and the people I care for by wearing the right PPE. Before I see a resident, I always complete a risk assessment by asking myself some questions to determine what the risk of infection could be. This helps me decide on the right PPE to wear before I provide care. There will be many times where all I need to wear is a mask or respirator, and other situations where I need to wear more. Before providing care, I prepare myself with the items I might need: gowns or aprons, eye protection, medical masks, P2N95 particulate respirators, disinfectant wipes, gloves, and hand sanitizer. Some of the PPE I'll need to change throughout the day, but other items I can wear for a whole session. I decide depending on the type of care I need to provide. Before putting on my PPE, I clean my hands thoroughly. In situations where I need to wear full PPE, I put on my gown or apron first. I fasten it behind my neck and at my waist. During COVID, my process can be a little different. I may already have my respiratory protection on. This could be a medical mask or a respirator. If a medical mask is the best choice, I hook the elastic bands behind my ears and fit the mask to my face. I make sure it fits well along my nose, cheeks, and below my chin. If a respirator is more appropriate, I position it over my nose and chin, pulling the top strap over my head to rest above my ears and the bottom strap to rest around my neck. I place my fingers at the top of the noseband and slide them down both sides, molding the band to my face. Checking the seal of a respirator is really important. I cup both hands over the edges of the respirator and breathe in and out. If I can feel any air leaking, then I know there's not a proper seal. I readjust until I know everything fits well and there's no leakage. Once my mask is on, I don't touch it again to avoid contamination. Eye protection could be goggles or a face shield. I adjust the strap around the back of my head to fit. When putting on gloves, I put them up high enough to cover the wristbands of my gown. If they ever get damaged or contaminated, I change them straight away. Now that I have everything fitting correctly, I can start providing care. When it's time to take off my PPE, I remove my gloves first. I peel them off one at a time and try not to touch the outside of them with my bare skin. I then dispose of them in the rubbish. I sanitize my hands. When removing my gown, I take care not to touch the front of it. I break the ties at the back, roll the gown down my arms, and fold the gown into itself. I then dispose of it in the rubbish. I sanitize my hands before removing any other items. There are many occasions where my eye protection can be worn for a session. If it's time to remove it and I know I can reuse it, I pull the strap over my head, taking care not to touch the front. I wipe the front with a disinfectant wipe, dispose of the wipe in the rubbish, and store the visor safely for the next time I need it. If I can't reuse it, I dispose of it in the rubbish. A lot of the time, it's okay for me to wear my respiratory protection for a session too. I can keep it on and sanitize my hands before I see my next resident. But when it is the right time to take it off, I grab the straps, pull them over my head, and remove the respirator away from my face without touching the front. I dispose of it in the rubbish. I clean my hands a final time. To keep myself safe, I follow this process every time I care for a resident and before I finish work for the day. Time for me to go.
Ngā mihi nui. Noho ora mai rā.